Hello and welcome. A media report suggests that on the 5th of February this year, 16 babies were delivered at the Okomfo-Anokye Hospital. Out of this number, 5 were allegedly stillbirth for those babies who were delivered alive across the country and indeed within the sub-Saharan Africa. Many of them do not have access to health facility and often do not live beyond the age of 5. 2013, the WHO report indicates that 6.6 million children below 5 years died in 2012 in the sub-Saharan Africa, largely due to pneumonia, malaria and diarrhea. Now, representatives from 40 countries are currently in Ghana to brainstorm on a project which they believe will improve the health of pregnant women, newborns and children in vulnerable communities, which is the Integrated Community Case Management, ICCM, approach. And what will it do differently in ensuring that Millennium Development Goals 4 of reducing child mortality is achieved by 2015? Now, we're going to find out, and to these questions, who are responsible for making these things better. With me in the studio is Daniel Yayamine, who's a child health specialist from UNICEF. And then joining us later will be Dr. Ebenezer Apia Dencha, who's the Director General for Ghana Health Service. He will join us later. Daniel, you're welcome.
Thank you very much.
Good. Now, first of all, I want to find out what brought about this meeting of 40 countries all constituting Ghana with regard. I know it's because of obviously child mortality rate, but why now? What has constituted for it to happen now?
Yes, thank you very much. As you said in your preamble, the fact that under 5 mortality is still a concern all over the world, and especially in sub-Saharan Africa. Mm-hmm. Governments in the region have tried to explore ways of really tackling the problem, especially to let our children survive, because they are the future of the nation or the future of the continent. Mm. And we're looking at all ways. And this approach, which is you mentioned as integrated community case management, targeting the 3 major killers of children, that is malaria, diarrhea, and pneumonia, is being implemented in the Africa region as well as other parts of the world for some time now. And the symposium was basically to share the evidence that has been generated all over the world, and especially in the African region, to learn best practices, how we can implement and improve our programming to better accelerate the progress that we desire in order to achieve the MDG 4 in particular,
which is reducing,
improving child health.
Sure. Some of them, if I take something like diarrhea, it is through bad water. I wonder what your organization would do. Do you then beg government that please filter the water for the children, or how do you influence it? Because that's sort of out of your hands.
Yes. The evidence suggests that, yes, water, as you rightly pointed out, is a major channel by which we get diarrhea. But we also do know that even there are simple measures by which we can treat the water, and also improving our own personal hygiene. Mm-hmm. So we are working with government, making advocacy. Of course, the best thing is that everyone has access to safe water. And of course, it also implying that we use it well. And in spite of all that, there are still other things that we can do, even in the absence of very safe water, that to prevent our children in particular from getting the diarrhea. And once they have got it, also, of course, it's very important that they are treated appropriately and promptly, because they die not because they got the diarrhea, because diarrhea, there are many causes, but they do not need to die after they've got the diarrhea. So what we do, as part of we make advocacy, of course, governments are responsible for providing all those social amenities to the population. Mm-hmm. So we will just play our advocacy role, producing the evidence to show that, look, in countries where the water supply is good and the coverage of safe water is high, diarrhea incidence goes down. Mm-hmm. The next step is that, well, yes, maybe we may not have reached that level where everyone will have access to safe water. What do we do that even under those circumstances, people do not get diarrhea? Mm-hmm. And that's why we promote a lot of behavior change. For newborns, we encourage or promote exclusive breastfeeding, and we also advocate or educate parents and child caregivers to wash their hands at certain critical times. But we know that, yes, if you go and defecate, no matter how clean your hands are, you could carry germs potentially introduced to your child. Washing hands before they prepare food or eating food. Mm-hmm. So these are some of the things we promote here. And adequate storage, even the safe water, after you've taken it from the point where it's very safe, depending on how you store it, it could become contaminated. We also promote adequate storage of water for use.
Okay. Doctor, one thing, I was going to go somewhere, but you mentioned something, so I just need to come back. And this is probably for my own selfish gain. You said breast feeding. Does the breast naturally filter what the mom, so that if the mom drank water which wasn't too clean and breastfed, does it filter or does it pass on to the baby?
Thank you very much. Of course, the breast, by the way it produces milk, it would have taken care of a lot of germs. Of course, we do know that a few germs like HIV and others get transmitted through breast milk. But majority, those of us, those which do cause the diarrhea, would have been filtered and taken care of.
Oh,
so
okay.
it's not likely to.
There's some filter there. There's some filter there. That's
let's call it the
that was just
natural filter.
That was just for my own concern.
Thank you.
The current sub-Saharan, within the sub-Saharan, what are our statistics now? Per 100, how many? What are our stats now?
Yeah. Well, maybe let me start on the positive note.
Good.
That globally, there's been a lot of progress in reducing child mortality. Mm-hmm. Africa too has made some progress. Sub-Saharan Africa has made some progress. Of course, that includes our brothers, the North Africa and others. Having said that, I will quickly add that yes, it looks like Sub-Saharan Africa has made the least progress of all the continents. From the early 1990s, it was between 173 to a little over 180 deaths per 1,000 live births. That's a lot. Wow. That was definitely a lot.
That's genocide, isn't it?
It's terrible. If you imagine that millions of children are born every year, 170 out of every 1,000 born dying before age of 5. It's definitely a very big problem. Now that we have made some progress, the figures are around 120. Of course, Sub-Saharan Africa is a very big basket of countries. Mm-hmm. So Ghana is done much better than a number of them. Ghana, ours is around 80 per 1,000 live births. The last survey, which was done in 2012, that was the figure we got. Not that we are happy, but we wish the progress would have been much better than that, considering the sort of interventions we've put in place. And we are looking forward to the next survey, which is somewhere this year, that it will show us a much better picture.
See, Doc, some of the things that you are highlighting, and I really don't want to sound patronizing or anything, but they're very basic. I mean, like from a mother to make sure that, as a baby, this water is not clean, or as a baby, let me wrap the baby because it's too cold or it's too warm, or I don't know, but is it not a bit basic or even instinctive to know that, oh no, I have to protect the child?
Yes, well, that is precisely why all this, let me call it the education and the publicity we're trying to give. That yes, largely these causes can be preventable. And as you pointed out, it looks very basic. But unfortunately, it's not common knowledge for a number of reasons. Some people may not just be aware that that can be done. Some people, for various reasons, are unable to do it. They simply do not have access to the clean and safe water that is there. And that is what they will use to prepare their food. And if they are able to cook the food too very well, then you can imagine that it will go on. And we also have a number of practices that we...
Okay, I'll take a break here, and then when I come back, I want to find out exactly what the integrated community case management, how is it that's going to help us. And then also, I think Dr. Ebenezer Appiah Denkyira will join us, so stay tuned. Reducing maternal and child mortality within Ghana and sub-Saharan Africa, a very, very sensitive and emotional subject, and a very vital thing that we need to tackle, hold the bull by its horns. But now we've been joined in the studio by Dr. Ebenezer Appiah Denkyira, who's the Director General of Ghana Health Services. And earlier on I was talking to Dr. Daniel Yayimain, who's a child health specialist for UNICEF. So these guys are pretty much guys who to talk about this issue. Dr. Appiah, you're welcome.
Thank you very much.
Doctor, let me start with you. This integrated stuff, how is it going to help us?
Well, integrated
community
case management.
Yes. Yes. How is it going to help us?
Well, it's a package put together to help us as Ghana as a country, because if you look at under 5 mortality is quite high, and apart from the neonatal period where the children died, between the 28 days and 5 years, the highest killer is pneumonia, malaria, and diarrhea. And these are the things that have been put together. So if we're able to get our health workers or the community agents to be able to handle this within the communities, then we are done. That means I will just...
see, the reason why I asked that is that obviously this summit is going on from this Monday.
Yes.
And I was just like, what will they say at this summit that you haven't already told your nurses and your guys on the field? What new will they tell them for them to say, that's the key, let's go out and do it?
Yeah, this one is sharing ideas from the various countries. Various countries are piloting.
Okay.
And they've come together. And then the 2 best ones are Ghana and Ethiopia. And then we are sharing ideas and telling people that it's very useful.
Also, you rather... Okay.
Yes, go scale up throughout the whole country. We are currently in 55 districts now. And they want to cover the whole country, all the districts. And ensure that any committee of nurse or any chief zone, you should have agents below you who will be doing that kind of stuff, and then you supervise them, whilst the medical assistant supervises you from above. So we believe that will be the quickest way of achieving our reducing under 5 mortality.
I'll stay with you, and with regards to, we picked pneumonia and diarrhea, but this recent issue that happened with Okonfanochi, and you could tell that sometimes, doctor patient or medical staff patient relationship, could really affect people severely, and in this case has been fatal, because all the reports indicate that their relation was not there at all. How are we addressing this issue while we are looking at this? So we just don't blame the water, but we look at our attitude as well.
Yes, I agree with you. We've actually met to discuss all the things that we need to do. We met the community first, and then they gave us a feedback that they did not appreciate the staff attitude. The elderly said that we treated them as the way we treat the young people. So our strategy is that Now there are 6,500 electoral areas. And so we are placing community health nurses in them. And they will visit house to house. First, they will list all the pregnant women, they will list all the babies. And then they will visit all patients that have been discharged from hospital or sick. And they will visit the elderly. So they will have a table of them. And that's their job. They visit them, give health education, treat them when as appropriate. And when it comes to the children, that is the ICCM. But there are certain areas which are further than they could reach, and that is where we use the community agents. So we realize that reaching these people in the communities will at least save us. It will improve our public image. And then they've been given the mobile phones. Airtel graciously donated 1,500 mobile phones.
Oh, that's good.
We're giving to all the community health nurses. And the idea is, as you go around, if there are any difficulty, just ring the health center. If it's a midwifery case, ring the midwife. If it's a general case, ring the medical assistant. And then we're also trying to bring all the district health workers together. We are now redefining hospital. It's not just a standalone hospital. It's a network of health providers. Hospital, health center, private maternity homes, CHIPs, clinics, all of them coming together. We are developing a directory so that now, before any case is referred, they ring and they make a room for admission or maybe receive teleconsultation as what should be done.
Okay.
We're also making sure that in every hospital they share that vision of making sure that we'll be friendly to patients, because that's the reason why we are there. We also make sure that every referral cases will have to make arrangement. Any case we discharge, we follow up, and all patients will have to give interpretation or maybe a reason for procedures, any procedure that we undertake. So we are educating people on this, and we know that it will improve the public image of the
it sounds a very good initiative. So then let me go to UNICEF, because UNICEF is the guys who got money. Is there any way we can biometric every child when that child is born, so that it's easier to track them in the system? Because here, unless you're about to vote, we don't seem to want to know about you until you're 18. But if you biometric, then you can even tell that, hold on, it's 3 years now and he hasn't showed up in any school, or he hasn't come for his checkup. So that, can you help us with that, UNICEF?
Thank you for the term. I think I like the biometric. Maybe I'll send it back to UNICEF. They say that we want to biometric every child who is born. And indeed, we have been working with a number of partners to really, exactly what you've said, that we want to document the birth of every child, starting even from the time the mother was pregnant with that child, and follow this child and ensure that the mother delivers in a very safe environment with a very skilled person, so that if any complication arises, the mother can be helped, the baby can be helped. And follow that child and ensure that the child gets registered, gets a birth certificate, because without that, you do not exist.
Yeah.
You get a birth certificate and ensure that you grow to get preschool, to go to school, and achieve your full potential. So, and as DG said, we know that at the moment, yes, a lot of them are still falling off because of preventable conditions. Yes, people may still die of malaria, but the numbers that are dying at the moment, if we look at the statistics, especially in sub-Saharan Africa, malaria, diarrhea, and pneumonia account for over 40% of deaths in children under 5.
Wow.
Which is a lot.
It's a lot.
And malaria, yes, even if it's not preventable in certain conditions, it can be treated early. And once it's treated early, the chances of survival are very high. And as for diarrhea, I do not see why a child should die of diarrhea. Because one, with the basic personal hygiene, improvement in the environment in the home, the water we drink can reduce diarrhea significantly. And we have, with Ghana government, introduced other vaccines which also help to prevent other causes of diarrhea. Recently, the rotavirus vaccine for children. Rotavirus is one of the major causes of diarrhea. And once children are fully vaccinated with that, it can further reduce. It's not the only one, of course. It's not the only cause of diarrhea. So people should not think that, oh, I've vaccinated my child, but why is he still having diarrhea?
Okay.
So with this, we think that, yes, we can accelerate the progress of reducing the mortality among children under 5. We are partner of government, of course. That is what UNICEF does, as he said, because we are in many countries, we see the best practice and come and whisper into the ear of government, oh, have you heard this thing is taking place in Niger? But Niger is a much poorer country than Ghana. But they are making rapid progress because of things like that. Overall, their mortality is still much higher than Ghana. But if you look at where they were and where they have reached, their progress is better than that of Ghana. Even though, yes, in absolute terms, our rates are lower.
But they have progress.
But they have progress.
Let me go to Dr. Apia Dejra. Now, this is one thing which is going to be a huge burden for you through no fault of yours, but teenage pregnancy.
Yeah.
Last year I hear you recorded 750,000, and some were very, very, very young, and obviously will not probably even have access to the information as to where to go, and probably of illiterate parents who also can't help. So how do we arrest this issue? Because you look at the population boom and everything. How? And it's very close to your door.
Yeah, it's actually frightening. But this actually needs a collective effort. And so in my regional tours, we meet the Kwima, the traditional council. We bring them together with the health workers. And we know that every community, they have Mrantihini, the chief youth leader. Yeah. Every community, they have them. So what we're telling them that if we show you the figure, and you want to do something about it, it's a matter of linking the youth leader and the midwife. It's bringing the youth together and identifying somebody who can counsel them. And that's all that they need. A book has been published, which we hope to, is talking about growing up and what they're supposed to face and so forth. And then we want to circulate that one. But I want to make sure that the community lives up to their responsibility by engaging the health workers to ensure that they provide those services. For the services, fortunately, we've had people who have been training them, and all that they need is just a space in the hospital or in the clinic where they will provide those things. So I believe that if we get a community effort and then the government support to be able to put a lot of resources in adolescent reproductive health, we're also engaging the youth department of the gender, the Ministry of Gender and Social Protection, that these ones we need to take them on. I believe that we can solve the problem. It used to be 20% of all pregnancies, but now it has come down to 12%. So what we are reporting is actually even a reduction.
Really?
Yes. It's a reduction. But we need to do more.
Yes, yes, because I can see it. But I can confidently gloat that in my town there's zero. I had zero. There was no teenage pregnancy. So I'm patting myself on the back.
Yeah, I believe in the community you can monitor that. Yeah. Yes, because once the people, the children, it's not their fault. As you grow up, I went to a class. And the class, I think a class Form 2 or something, and asked them how many people were told about menstruation. Almost half the class were taken by surprise. Nobody ever told them, neither the mother or senior sister or anybody else. So it means it's like a taboo sort of in our community. And we need to take note of that and ensure that now we gather them, the youth in the church or in the mosque or wherever, and then they engage somebody, a knowledgeable person to advise them and then provide the services. And that's actually what we want to do.
Let me go to UNICEF, Dr. Yaya Mai. Again, can we probably get the women before they become pregnant? Because we seem to always wait for the pregnancy to come and then have antenatal classes, and they're probably by then too heavy to walk to antenatal classes. I don't know if it could be part of the program where before you even become pregnant, look, these are the things to expect and these are the things to do, or I don't know if...
Let me quickly, before I address what you've asked, let me relate it to what the DG has just said. Actually, addressing the issues of teenage pregnancy should be multisectoral, because you are looking at it's close to the DG's doorsteps, but it was caused somewhere as a result of things not going well in the home. They are not giving information, so they suddenly are overwhelmed by the changes in their body and they do not understand anything. Somebody needs to tell them. Are the teachers a way of giving them information on this? Otherwise, then they get the wrong information from their peers who put pressure on them, and they indulge in things they cannot cope, they don't understand, and get bad outcomes. Now, in terms of your question was about what UNICEF, is it UNICEF's role or what we can?
Well, as part of the program, if we can capture
them early before
they even get pregnant.
Yes. Yeah. So, yeah, there is what we call the life cycle approach or continuum, okay, so that we deal with every stage of the life. So we are talking about children. We know that we want them to survive, but when they get to adolescence, they also have their problem. We have to deal with them before they remain healthy, so that they can be pregnant. Otherwise, it will even contribute to children dying in their neonatal period, because they are born very small, they are born to small mother, they cannot be delivered and all those things. So yes, so what we are doing, as the DG has said, we are working with government and other UN agencies, of course, to address the issue of teenage pregnancy and its relationship, situations with maternal mortality. With government, we've developed the MAF, which is the Millennium Accelerated Framework for dealing with improving maternal health. And it has 3 prongs. Of course, skilled delivery is one of them. Emergency obstetrical care is another. And of course, the issue of family planning and
family planning. We'll come back to family planning, because that's one thing that's going to reduce this teenage pregnancy, even though it's a taboo to mention it to kids. Stay tuned, we'll be coming straight back. Hello and welcome back to this very important discussion. And just before we went on the discussion, we were looking at child mortality, we're looking at teenage pregnancy, and Dr. Yayamain just said family planning. But as soon as you mention family planning to a child, the Christians will be on your neck, the Muslims will be on your neck, even some traditionalists will be on your neck. As we like to pretend that it's not there and don't even talk about it because they don't know about it. But these days, with their phones and access to, they even know more than we do. When are we going to realize, so that we can teach them from early childhood? Because then we can prevent so many of this. I mean, how do we tackle it?
Actually, the family planning, people misunderstand it. Because it just, I believe the word is plan, the family. It's an aspect of planning. So as the child grows, he has to know something. He has to know the future. I mean, trying to forecast the future and then arranging your steps to meet it is actually planning. And so when it comes to the youth, all that you're saying that this is the future, you are entering into a zone where you have body changes, anatomical changes, physiological changes, and then it makes you liable to become pregnant, and then you have to be responsible. But then you need to wait. And this is what you can do to wait. And that information, the person needs, if the person doesn't get it, you get it from the net. The youth, they have access to the net. They will get it from friends at school. So it's better you inform them
properly.
So actually, we in the youth, for the youth, we don't call it family planning. So adolescent reproductive health or sexual education, adolescent sexual education, for which, I mean, they are entitled to. And so we want to use this platform to inform the pastors and the imams and other people that they should actually organize such classes for the youth. They should get a knowledgeable person to come and educate them, because what is the use? You worship together and you are not told about what is likely to bring to you as a temptation. You will fall to it. And that's the truth. So I think family planning comes in different ways.
Okay. Let's look at the GIDA aspect of this. How are you collaborating with GIDA to spread this news?
Yes, unfortunately, the GIDA youth, but otherwise we are working together. In fact, most of the youth trained are working in the health facilities, the health workers, they work in the community, so we're all working together. Wherever you go to every health center, you find the youth there. And so we work together. The curriculum for training the youth were developed by we took them through the Ghana Health Service and the JAG, supported by the various organizations. They help in developing the manual. So we're actually working together.
Okay.
Yeah.
Okay. Now, motivation and sustainability of this program is vital. And Dr. Yami, how is there a plan to keep motivating people? Maybe give them a new phone every year so that they're excited. You know, how do they get? Because some people will be sent to areas where they really don't want to be there.
Maybe DG would better
help me with that.
But let me say that yes. There are different cadres of people providing health services. If we start with the community volunteers that Director General and I talked about earlier, yes, those ones, they are selected by their community, and the health sector goes and sits with the community and says, well, look, these people are providing you a service. Ghana Health Service, or that matter, Ministry of Health is not paying them. What can the community do? They are providing you a service. You need that service at a time that it may be very difficult for you to go to a health center or go to a hospital. And it's just at your backyard. You go there in the middle of the night and it gives you the malaria treatment that if you struggle to go to the hospital, it will be the same ACT that will be given to you. If you have diarrhea, it will be the same ORS that you get even in Kuala Lumpur. It will be the same zinc tablets that you'll be given, even if you were to come to Accra. So if the person is providing you this kind of service, what can you do as a community to help the person to continue to provide this?
So the community should also get involved.
Then, of course, the health sector, because we also use them, yes, it's not a salary, but we do once in a while use them to provide a service where there's some stipend is given to them, but it's not a salary. So yes, the issue of motivation is very critical. We train them, they are happy, but they will need a little more than that. And that's why we're asking these assemblies and other places. You've not yet been able to place a nurse in the community. This fellow is there. What can you do to help? Let
me bring Dr. Appiah in here. Doctor, by 2015, with all these new, if the communities get involved and everything, are we going to achieve our goal, or are we still a bit off the mark?
Well, if you use the word if yes. So if we get all our acts together, then we can achieve. Because the idea, as he mentioned, is to identify all the children where they are, and then get somebody to monitor them. And so far as you monitor somebody, it means that you can keep the person surviving, unless maybe some witch somewhere. But otherwise, you find that it's easy enough. All pregnant women, you know where they are, and then you follow them up, and then you link them up. So you make sure that the only thing that I foresee is that the institutional arrangement, the hospitals or health centers, if we get it wrong, that is where the problem will be, but not the community. After the community, it's more also of infrastructure, the road network and so forth. We have to get them right. And for what we try doing is that if a pregnant woman is far off, and we see that there's a danger in your risk, mind if only 15% of the pregnancies end up complicated. So we make sure that you come nearer to a health facility where when there's a problem, you can have access. And that's why we have the mothers' hostels, and sometimes if there's a relative, you stay by, or you go to a place where the facilities. So I believe that if we get all those things, we'll be able to get down.
Within Adumasa, where I am, there's about 16 communities, and it's really large, and we have one midwife.
Yeah.
You know, and she's quite elderly. I mean, and she's been there for 23 years, and the poor woman wants to retire. And every day I keep begging her, the Ministry of Health keep begging her, please don't leave. You know, and she's still there. God bless her. You know, helping us. But and she's elderly. Yeah. You know, she can't ride the bike, so which means you have to get to her because she doesn't drive either. Yeah. Once you get to her, she will look after you. And the old ladies trust her that even if she says you are well, they get well. But it's getting to her. So in this case, you know, how do we then get the pregnant woman from Kudi Kope to come and stay in Edumasa just in case overnight pregnancy? So how do we work?
Yeah, that's a committee effort. I believe in multi-sectoral effort. If the traditional leaders have taken that decision that everybody in this committee will survive. If that's the case, then they look at where do we get a midwife or a nurse. They approach health, and that is the concept of CHIPS. In the Novrongo concept where it was started, the committee themselves built the compounds and then invited a health person, come and stay in there. And now we are fortunate, we have mobile phones all over the place. So if we had that one, then we'll be able to link them to the next level of care. And we are producing 2,000 community evidences every year. And we are training 1,000 midwives every year. So we are redeploying them. That's why our figures, we may not be able to get to that of the developed country, but for the target that we set ourselves, even though it's quite high, I believe that when we put our things together, we'll be able to get very close to it or even
Are we wholesaling them and losing that quality, that human touch that they are supposed to have? Because sometimes the patient wants the human touch rather than the medicine, and we seem to be getting more medicine than human touch. Yeah, go and take this.
Yeah, we need correction in that. Actually, one traditional leader prompted me. I went to visit him. I said, look, your people, they've forgotten the culture. They don't know that when they come to the community, they have to come and see me, greet me, and they have to come with all their staff. And then I will teach them the culture. I will tell them who Benkumhini is, Queen Mother's rule, and Chiami their rules, and how, if they have any problem, how to send that around. And actually, we've realized that, and so we're going to make sure that we work together. There's something that we started, the community decision system. I think UNICEF supported that, the UNFPA.
Well, I need to say thank you here, and that's all time will allow us, but it's been very insightful. I couldn't answer all your questions, I know, because it's very important, but maybe one day I'll get these gentlemen back in here so we can talk about it. So thank you very much. And as I always say, thanks for watching, and tomorrow we'll be back to do it all over again.